how bad this pandemic will become or how long it will last. I am guardedly optimistic that science will come to our rescue and that we will develop more accurate tests and more effective treatments, as well as that all-important vaccine. Chapter 1. Portrait of a Serial Killer. The Chinese military strategist Sun Tzu wrote in his classic book, The Art of War, that victory comes from understanding your enemy. So what have we learnt about this novel virus? We know that SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2, to give it its full name, is tiny. It is just 120 nanometers, that is billionths of a metre across. You could fit 100 million viral particles on the head of a pin, and yet you would only need to be exposed to a few hundred to get infected. If you do get infected and develop symptoms, then the disease you get is called COVID-19. SARS-CoV-2 is a killer with a range of impressive superpowers, including the ability to travel amongst us undetected, infect almost everyone it meets, and then reproduce liberally, before jumping off in search of a new host. It has found a range of ingenious ways to hide from its most deadly enemy, our immune system, and, thanks to the airplane, it can travel from one side of the globe to the other at astonishing speed. Like other viruses, it is not exactly alive, and it certainly doesn't have a personality, but I like to think of it as a cunning enemy. That is why I will be using the metaphors of war when it comes to the battle that we face. It is also why, for the purposes of this narrative, I'm going to give the virus agency and purpose, which it clearly doesn't have. Viruses don't plan, seek out, or attempt to avoid. They are mindless scraps of genetic material, brilliantly adapted by evolution for one purpose: to reproduce and spread as far and as fast as they can. And finally, although its proper name is SARS-CoV-2, from now on, for simplicity's sake, I am going to refer to it as the COVID-19 virus. The COVID-19 virus represents the greatest public health crisis of the last 100 years. As we'll see, only by mobilizing the scientific community and by committing huge resources are we likely to be able to keep the death toll down and return to any sort of normality. Meet the enemy. Despite the huge threat it poses, the COVID-19 virus is relatively simple. Its core is a single strand of ribonucleic acid, RNA, which stores all the genetic information the virus needs to reproduce. Think of it as a COVID-making instruction manual, just 30,000 letters long. A human-building instruction manual, by comparison, comes in the form of DNA, which is tightly packed into our cells in 46 manuals known as chromosomes. Put those 46 manuals together and you get our genome, which consists of 6.4 billion letters. If you took all the DNA from just one of our cells and stretched it out, I've done it, then it would be around 2 meters long. Take it out of all your cells and it would be 10 billion miles long. We are large, complicated and clever. COVID-19 is not. Yet it has us on the run. This short strand of COVID-19 RNA is protected by a fatty outer membrane, which is quite fragile. It breaks apart when it meets soap and water, which is why hand washing with soap is so important. The outer membrane of the virus is studded with club-like spikes, which give the virus its name, corona, meaning crowns, and which it uses to get into our cells. These are also a potential area of vulnerability. It is those spikes, as we will discover in Chapter 5, that most vaccine makers are targeting. The way the virus spreads is mainly through coughs and sneezes. If someone who is currently infected with the virus coughs or sneezes near you, out will come a cloud of viruses. If you are unlucky enough to inhale just a few hundred particles, then they could get into your throat and will immediately start looking for cells to invade. The invasion begins. The good news is